In today's video, we explore 15 behavioral nursing assistant interview questions and answers. Don't forget to customize these answers to highlight your unique qualifications and experiences. Here's a bonus tip. Research the company and review the job description so you can incorporate key skills relevant to the job role in your answers. You can find the link to general, clinical, and team-based nursing assistant interview questions in the description below. Question number 1. Describe a time you dealt with a difficult patient. Behavioral questions like this are meant to evaluate your patience, empathy, communication skills, and professionalism under pressure. Interviewers want to see that you can remain calm, prioritize safety, and de-escalate situations without taking things personally. Use the STAR method, situation, task, action, result, to structure your answer clearly. Emphasize your ability to treat patients with dignity even when they're upset, and show what you learned from the experience. During my clinical training, I cared for a patient who was often agitated and refused assistance with daily activities. They would raise their voice and push my hand away whenever I tried to help. Instead of reacting with frustration, I took a step back to understand why they felt that way. I calmly introduced myself each time, explained what I was doing before touching or moving them, and offered small choices, like asking whether they preferred help now or in 10 minutes. This gave them a sense of control and built trust. I also spoke with the nurse about strategies and reviewed the patient's care plan to better understand their triggers and preferences. Over several days, the patient became more cooperative, and we established a routine that worked for them. That experience taught me the power of patience, communication, and empathy in difficult situations. It also reinforced the importance of never taking a patient's frustration personally. Often, it's fear or discomfort, and with the right approach and teamwork, we can make their care experience much more positive and dignified. Question number 2. Describe a time you resolved a conflict with a coworker. Interviewers ask this to assess your teamwork, communication, and professionalism. They want to know that you can handle disagreements maturely without letting them affect patient care. Use the STAR method. Describe the situation, explain what caused the conflict, show how you communicated and collaborated to resolve it, and share the positive outcome. Keep the focus on teamwork, respect, and patient-centered care. During my clinical rotation, I worked with another CNA trainee who had a different approach to dividing daily tasks. They felt I wasn't pulling my weight, while I believed we had agreed on sharing responsibilities equally. Instead of letting tension build, I suggested we step aside during a break and calmly talk through our concerns. I listened to their perspective without interrupting, explained mine, and together we created a clear task list that felt fair to both of us. We also agreed to check in briefly each shift to stay aligned. Once we communicated openly, the atmosphere improved dramatically and our teamwork became much smoother. Our patients benefited because care was more organized and we supported each other better. That experience taught me that most conflicts come from miscommunication, and they can usually be resolved by staying calm, listening actively, and focusing on the shared goal, delivering excellent patient care. I carry that approach into every team I work with, knowing that collaboration and respect are key to a safe, positive healthcare environment. Question number 3. Tell me about a time you went above and beyond for a patient. This question helps employers see your dedication, empathy, and willingness to exceed expectations. They want to know that you care deeply about patients and will go the extra mile when needed. Use a specific example that shows initiative, compassion, and a positive outcome. Emphasize how your actions improve the patient's experience or comfort. During my clinical training, I cared for a patient recovering from surgery who often felt anxious and withdrawn. While my primary tasks were assisting with hygiene and mobility, I noticed they seemed isolated and rarely engaged with staff. I decided to take a few extra minutes each day to sit with them, ask how they were feeling, and listen without rushing. I also learned they loved music, so I asked permission to play soft music on a tablet during care tasks, which helped them relax. Over time, they became more communicative and even began participating more actively in their therapy sessions. Their mood and confidence noticeably improved, and their family thanked me for the difference they saw. That experience showed me how going beyond basic duties, by paying attention to emotional needs and building trust, can have a powerful impact on healing. It reminded me that being a CNA is not just about physical care, it's also about compassion, connection, and creating a sense of comfort and dignity for every patient. Question number 4. Describe a time you received constructive feedback and what you did. Interviewers ask this to assess your self-awareness, willingness to learn, and ability to accept feedback professionally. A strong answer shows that you don't take criticism personally, you act on it, and you grow as a result. Choose an example that highlights your openness and how the feedback improved your skills and patient care. During my CNA training, my instructor pointed out that I needed to improve how I documented patient intake and output. I was recording everything, but sometimes missed small details like precise fluid measurements. Instead of feeling discouraged, I thanked them for the feedback and asked for tips to improve. I began double-checking my notes, slowing down slightly to focus on accuracy, and reviewing documentation examples from experienced staff. I also practiced during downtime by writing mock entries to get more comfortable with proper formatting and detail. Within a short time, my documentation improved significantly, and my instructor praised my progress. That experience taught me that constructive feedback is an opportunity, not a setback. It helped me become more thorough and detail-oriented, which directly impacts patient safety and care quality. Now I actively seek feedback because I know it helps me grow into a stronger healthcare professional. It also taught me to approach new challenges with curiosity and humility, which I believe are essential qualities for anyone working in patient care. Question number 5. How do you handle stressful or fast-paced shifts? This question evaluates your ability to stay composed, organized, and effective under pressure. All critical skills in healthcare. Employers want reassurance that you won't become overwhelmed or make mistakes in high-demand situations. Explain the strategies you use to stay calm and focused, such as prioritizing tasks, communicating clearly, and relying on teamwork. I know that stressful or fast-paced shifts are part of working in healthcare. So I focus on staying calm, organized, and patient-centered when they happen. My first step is to prioritize tasks based on urgency and patient safety. For example, assisting someone at risk of falling takes precedence over restocking supplies. I also make sure to communicate clearly with nurses and teammates about what's been done and what still needs attention, which prevents confusion and helps us work efficiently together. Deep breathing and maintaining a positive mindset help me stay composed even during hectic moments. During my clinical rotations, there were times when call lights were going off constantly and several patients needed help simultaneously. Instead of panicking, I broke tasks into steps, delegated when possible, and kept patients informed about when I'd return. Everything got done safely, and patients remained calm because they felt cared for. Those experiences taught me that preparation, teamwork, and a steady approach are key to thriving under pressure and delivering consistent, high-quality care, even on the busiest days. Question number 6. How do you handle multiple call lights or competing requests? This question tests your time management, prioritization, and communication skills. Employers want to see that you can stay organized under pressure without compromising patient safety or quality of care. A strong answer shows how you assess urgency, communicate expectations to patients, and work as part of a team to ensure everyone gets the support they need. When multiple call lights or competing requests come in, I focus on staying calm, prioritizing based on urgency, and communicating clearly with both patients and team members. My first step is to quickly assess which calls are safety-related, such as someone needing help to the restroom or a fall-risk patient trying to get up, and address those immediately. For non-urgent requests, I reassure patients that I will return shortly and give them an estimated time. I also notify other CNAs or nurses if I need help managing multiple needs at once, because teamwork ensures no patient is left waiting too long. During one busy clinical shift, I had 4 call lights at once, so I handled the most urgent situation first, updated the nurse, and returned to each patient promptly. Everyone received the care they needed and no safety incidents occurred. That experience taught me that organization, communication, and teamwork are essential in balancing multiple priorities while still making patients feel heard, respected, and cared for. Question number 7. What would you do if you made a mistake during care? This question is about honesty, accountability, and patient safety. Employers want to know that you will take immediate action if something goes wrong and that you understand the importance of reporting errors. Be clear about the steps you take. Stop and correct the mistake if possible. Notify the nurse immediately and reflect on how to prevent it in the future. If I made a mistake during care, my first priority would be patient safety, followed closely by honesty and prompt reporting. I would stop what I'm doing immediately, assess the patient for any potential harm, and notify the nurse or supervisor right away, even if the mistake seems minor. Transparency is critical in healthcare because it ensures the patient receives the right care as quickly as possible and helps the team take corrective action. After addressing the situation, I would review what led to the mistake, whether it was rushing, misunderstanding instructions, or something else, and discuss ways to prevent it from happening again. During my training, I once documented a vital sign incorrectly and caught it shortly after. I reported it immediately, corrected the record, and implemented a habit of double-checking before entering data. That experience taught me that mistakes can happen, but how you respond defines your professionalism. I'm committed to being transparent, learning from errors, and continuously improving because patient safety and trust must always come first. Question number 8. What would you do if you suspected abuse or neglect? This question evaluates your understanding of CNA responsibilities and legal obligations. Employers want to ensure you'll protect vulnerable patients and follow proper reporting procedures. A strong answer shows that you would remain calm, document observations objectively, report immediately to the nurse or supervisor, and continue advocating for the patient. If I suspected abuse or neglect, I would take it extremely seriously and follow the proper procedures immediately. My first step would be to ensure the patient's immediate safety and comfort while remaining calm and supportive. I would document any observations factually and objectively, such as unexplained bruises, sudden changes in behavior, or poor hygiene, without jumping to conclusions. Then I would report my concerns right away to the nurse or charge nurse, as CNAs are mandated reporters and must act quickly to protect patients. If necessary, I would continue reporting up the chain of command until I was confident the situation was being addressed. During training, we discussed real scenarios like this, and it reinforced for me how crucial it is to speak up, even if I'm uncertain, because failing to act could put someone at risk. My role as a CNA is not only to provide care but also to advocate for patients who cannot always advocate for themselves. Protecting their safety and dignity will always be one of my highest priorities. Before we continue, I just want to take a moment to thank you for watching this video. You can download a copy of these interview questions and answers in PDF format by clicking on the link below and supporting my channel by making a minimum donation of $3. Your support allows me to keep creating valuable content to help you pass your interview and land your dream job. Thanks for your support and appreciation. Question number 9. How do you handle a situation when you disagree with instructions? This question reveals your professionalism, communication skills, and respect for the chain of command. Employers want to see that you can express concerns appropriately without causing conflict. A strong answer shows that you clarify instructions, ask questions respectfully, and escalate only when necessary, all while prioritizing patient safety. If I disagreed with an instruction, I would first take a step back and make sure I fully understood what was being asked. Sometimes disagreements come from miscommunication, so I would respectfully ask for clarification to ensure I'm not misunderstanding the task. If I still had concerns, especially about patient safety or protocol, I would calmly explain my reasoning and share what I observed. For example, if I believed a patient's condition had changed and a certain action might not be safe, I would express that respectfully and seek guidance from the nurse or supervisor. During my clinical rotation, I once questioned an instruction about transferring a patient who appeared too weak to stand. After I voiced my concern, the nurse reassessed the patient and decided on a safer approach. That taught me that communication and respect are essential when handling disagreements. My priority will always be patient safety and teamwork, and I believe raising concerns the right way strengthens the quality of care we provide. Question number 10. How do you stay calm and effective during a code or emergency? This question measures your composure, teamwork, and ability to follow protocol under pressure. Employers want reassurance that you can stay focused, respond appropriately, and support the team during emergencies. A strong answer highlights clear thinking, quick action, and adherence to training and procedures. In a code or emergency, I focus on staying calm, following my training, and supporting the healthcare team as efficiently as possible. I know that remaining composed is essential because panic only slows response time and can compromise patient safety. My first step is to quickly assess the situation, call for help if it hasn't been done, and follow the instructions of the nurse or charge nurse. Depending on the situation, that might include clearing the area, retrieving emergency equipment, assisting with CPR, or providing vital information about the patient's condition. During a clinical experience, I witnessed a patient become unresponsive, and while the nurse initiated CPR, I immediately called the code, cleared the hallway, and brought the crash cart. The team responded quickly, and the patient was stabilized. That experience showed me the importance of staying focused and knowing my role. I'm confident in my ability to stay composed, communicate clearly, and act quickly in emergencies, always prioritizing patient safety and teamwork. Question number 11. How do you approach a situation where a patient refuses care? Interviewers ask this to evaluate your empathy, communication skills, and respect for patient rights. They want to see that you can balance patient autonomy with safety. A strong answer shows that you remain calm, try to understand the reason behind the refusal, communicate respectfully, and report to the nurse if needed. If a patient refuses care, my first step is to remain calm, respectful, and understanding. I never force care. Instead, I try to understand why they're refusing. Often, it's due to fear, discomfort, pain, or simply wanting more control. I would calmly explain what the care involves, why it's necessary, and how it benefits them, using clear and compassionate language. I might offer choices, such as performing the task later or in a slightly different way, to help them feel more involved. During my clinical training, a patient once refused assistance with bathing. I spoke with them about their concerns and learned they were embarrassed. I assured them of their privacy, offered to let them handle parts of the task themselves, and returned later, at which point they agreed. If refusal continued, I would document it accurately and notify the nurse immediately. That experience taught me that patience, communication, and respect often lead to cooperation, and that honoring a patient's dignity while still prioritizing their safety is essential to providing quality care. Question number 12. Describe a time you had to adapt quickly to an unexpected change during your shift. This question shows how well you handle unpredictability, a common reality in healthcare. Interviewers want to see that you can stay calm, think quickly, and reprioritize when things change suddenly. Use a clear example that highlights flexibility, teamwork, and patient focus. During one clinical shift, I was assigned to assist with morning care for several patients when one unexpectedly developed breathing difficulties. The nurse asked me to stay with the patient, monitor their condition, and provide comfort while she contacted the physician and prepared for further intervention. This meant I had to adjust my entire plan for the morning. I quickly communicated with the rest of the team about my change in responsibilities and asked for help covering my other patients to ensure no one was left unattended. I stayed focused on keeping the patient calm, monitoring their breathing, and reporting any changes immediately. Once the situation stabilized, I returned to my regular duties and caught up on my tasks. That experience taught me the importance of flexibility, teamwork, and staying composed under pressure. In healthcare, no 2 days are the same, and being able to adapt quickly ensures that patients continue to receive safe, attentive care even when plans change suddenly. Question number 13. Tell me about a time you helped a patient feel more comfortable or calm in a difficult moment. This question highlights your compassion, emotional intelligence, and ability to provide holistic care. Employers want to see that you understand patients' emotional needs and can help them feel safe and supported. Choose an example that shows empathy and a meaningful outcome. During my clinical experience, I cared for an elderly patient who became very anxious before a routine procedure. They were trembling, asking repeated questions, and refusing to leave their room. I knew my job wasn't just physical care. Emotional support mattered too. I sat beside them, spoke gently, and explained each step of what would happen in simple, reassuring terms. I also held their hand and shared that it was normal to feel nervous, but that the healthcare team would be with them the entire time. After a few minutes, their breathing slowed and they agreed to proceed. Later, they thanked me for taking the time to talk instead of rushing. That experience reminded me how much small actions, a calm voice, patient listening, and reassurance can reduce fear and improve a patient's experience. As a CNA, I believe that helping patients feel safe and cared for emotionally is just as important as assisting them physically, and I bring that mindset to every patient interaction. Question number 14. Describe a situation where you had to advocate for a patient's needs. This question assesses your ability to speak up for patient safety and well-being. Employers want to know that you won't ignore concerns and will act as a voice for patients who can't advocate for themselves. Choose an example that shows initiative, observation, and communication. During my clinical rotation, I noticed that a patient who was usually alert and communicative had suddenly become confused and drowsy. Although I wasn't sure of the cause, I trusted my instincts and immediately reported the change to the nurse. I provided detailed observations, including when the change began and any other symptoms I noticed. The nurse assessed the patient and discovered their blood sugar had dropped significantly, prompting immediate treatment. The patient recovered quickly and returned to their usual state later that day. That experience showed me how important it is for CNAs to advocate for patients and communicate any changes, even if they seem minor. Patients rely on us to notice details they can't always express, and timely reporting can make a real difference in outcomes. It also reinforced for me that advocacy is part of my daily responsibility. Speaking up respectfully, providing accurate information, and ensuring every patient's needs are heard and addressed promptly. And finally, here is the last of our behavioral nursing assistant interview questions. Question number 15. How do you handle a situation where you witness a colleague not following proper procedure? This question evaluates your ethics, professionalism, and commitment to patient safety. Employers want to ensure you'll address issues appropriately without creating conflict. The best answers show you would remain calm, prioritize safety, clarify if needed, and escalate if necessary. If I witnessed a colleague not following proper procedure, I would handle the situation professionally and carefully, always prioritizing patient safety. My first step would be to assess whether the action poses an immediate risk. If it did, I would intervene politely but firmly. For example, reminding them about hand hygiene before patient contact. If it wasn't urgent, I might ask a clarifying question to give them a chance to correct themselves, as sometimes mistakes are unintentional. Regardless, I would report the incident to the nurse or supervisor so it could be addressed appropriately. During training, I once observed another student forget to lock a wheelchair before transferring a patient. I calmly pointed it out and ensured the patient remained safe, then informed the instructor afterward. That situation taught me the importance of speaking up respectfully and without blame. My goal is never to embarrass a colleague but to protect patients and maintain high standards of care. I believe accountability and teamwork go hand in hand, and addressing safety issues is part of my responsibility as a healthcare professional. If you want to learn more on how to land jobs and reach your career goals, don't forget to hit that subscribe and bell notification button to get new videos every single week. Also, don't forget to hit that like button because that motivates me to keep doing what I do. Stay safe, keep smiling, and good luck.